that atrial fibrillation is one of the most common sustained heart rhythm disorders in the general population, with a community prevalence of about 0.5 to 5.5% worldwide. It is often asymptomatic, with stroke being the first manifestation in some. Atrial fibrillation burden in the community and the practice of stroke prophylaxis, however, is still lacking in India. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about the challenges that are faced to estimate the prevalence of atrial fibrillation as well as stroke risk in rural India. Studies conducted in India have shown wide variations in atrial fibrillation prevalence, ranging from 0.1 to even up to 1.6%. Now, unfortunately, in Indian population-based information on atrial fibrillation is still limited. Moreover, the available knowledge on atrial fibrillation as well as the oral anticoagulation practices are largely derived from the hospital-based studies. Now, a recent study in the Indian Heart Journal conducted a community-based cross-sectional study which is done in rural Andhra Pradesh. The adults from 40 villages formed the study population, and door-to-door survey was performed to collect information on demographics as well as medical history. Electrocardiogram was also recorded using a smartphone-based device. Participants diagnosed with atrial fibrillation underwent the echocardiogram. The study cardiologists, they assessed the cardiovascular risk profile and also collected the detailed medical history of every patient. Now, it was found that 14 of the 4,281 individuals screened had atrial fibrillation. The study results also showed that except for one, all were non-valvular atrial fibrillation, 3 had a history of stroke, while 2 were on anticoagulant therapy. So, the prevalence of atrial fibrillation is lower in this study compared to the studies from the developed countries. However, non-rheumatic cardiovascular risk factors were primary causes. So, the authors, keeping all these factors in view, concluded that the non-adherence to stroke prophylaxis is a major threat that definitely needs to be addressed. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.